I'm just curious, as the state, as you get more information from this project, what are you hoping to do if you can kind of gather better information about overdoses and the different types of overdoses?
That's a great question. Really, our hopes are the better the data is, one, the faster we can respond. Second, the more deaths we can prevent. I repeatedly tell myself that there's better information than just fatalities to gauge our success on fighting the substance use disorder in our area. But right now, that's all I have. And so I'm hopeful as we kind of move up the stream towards more upstream prevention, we'll be able to get data that isn't a week or 5 weeks old, but will be more representative of the last 24, 36 hours, because they'll have access to resources we don't. So yeah, just more like we can't measure how well we're doing because we don't know how bad it is.
Yeah.
If that makes sense.
No, I understand.
Like, and we're like, oh, it's so bad, but I can't say, look at everything we've done. And we know what we're doing is working, right? We've distributed almost 2,000 doses of naloxone just in the last 8 months. That's just us. Well, there's 6 other naloxone boxes in the county that distribute naloxone. So the jail goes through 600 doses easily a month. So we know that that's getting out there. We can't really see true impact if we don't have a good starting point.
Thank you. Very good. Any other questions on the health officer's report for Dr. Bershutham? I just have one thing that additional thing just to, I think we'll probably hear about it later from on foods is we have a new code coming in with 35%. So I don't know if you want to talk about it now or later.
We'll talk about it at the end of the presentation. There's a slide.
Okay. That sounds impactful.
It will be.
Any other questions on the health officer's report?
Oh, I did just wonder, in the food services unit, they mentioned that there was a fire and a couple of retail stores had to close. Or I'm sorry, there was a water burst, a pipe burst, and the fire department was called, and a couple of stores had to close due to no water. I was just wondering, has that been resolved, or are they able to open again?
You want to talk a little bit about that situation?
I'll just come on up since I have to be here anyway.
Carolyn Smith, Food Service Director. Yes, it was a strip mall on Western Avenue. One store opened back up immediately, and the other was 2 days later, but that was all resolved.
And I guess in the presentation, you're going to give us in more detail how you're involved in situations such as this, I'm assuming. Like what happens when there's a fire or water main.
That is my intent.
Very good. We get the preview with the slides, so.
Any other questions on the health officer's report? All right.
Okay, well, with that, since we're talking about food, we'll move on to the food and pool service unit presentation.
So of course, I'm Carolyn Smith, as I said, the Director of Food Services, and Karen Teague is Assistant Food Service Director. And we're going to kind of tag team here. I wanted to, first of all, say thank you. I am nervous as I don't know what, and I don't know why. I've been in this job for 27 years. I could go it backwards and forward, but just standing in front of you all together, not one-on-one, I'm nervous. So I want to get that out of the way. But even saying that, I want to say that it is really a pleasure for me to act as if captain, as it were, for an awesome team of inspectors. And it's on their behalf that I wanted to thank you for this opportunity to just highlight, some of the things that we do. It's my intent during this presentation for us to take a peek at who we are, to view what we do and why we do it, to look at the various services that we provide and to take a glimpse at some 2024 goals. That's not on that slide. That you got that for free. But you can see 106.5 years is nothing to, to blink about. And I thought when I was thinking about that, I said, our unit could really be called centenarians because we're over 100 years combined service. And so again, it's my pleasure to be at the helm of this awesome team. I want you to tell you a little bit about our team, who we are. So yes, we're next slide, please. We're communicators. We are agents of the Indiana Department of Health, agents of our health officer. We're educators, we're instructors, we're communicators. But I want to tell you a little bit about what the team brings, before we're health inspectors. Collectively, we have 8 BA degrees, 1 master's of biology. 8 of our staff hold food protection manager certifications. 3 of our staff are certified pool operators. And together the staff has numerous other industry-related certifications and certificates. In addition to that, for the past 24 years, a member of our staff has been has taught food safety and sanitation at Ivy Tech continuously. So that's 4 different people over the last 24 years have been at Ivy Tech. They are awesome. They are awesome. Part of the orientation for our inspectors includes 42 hours of web-based training, and this training is from the FDA. And the components of it include health principles, basic food laws, inspection process, microbiology, foodborne pathogens, and communication skills for inspectors. And that's just part of the 42 hours of training that everybody who is an inspector goes through prior to going to the field to do inspections. Next slide. So what we do, of course, we inspect establishments to assess their overall level of compliance. We enforce the laws. We review past inspections and inspection reports and check records both at the establishment and before we get to the establishment. This is so that we already have, by the time we get there, we have some idea of what their past inspection history has been like. We observe and interview the staff, and we recommend appropriate interventions. But some of the records that we're looking at, again, is to make sure that they are complying by taking temperatures. Our visit is a snapshot in time. So all we can assess and all we can really speak to is what we see at the time. So it is their responsibility to maintain records of food logs and temperature logs for equipment, maintenance issues if they've had any, inspections for pest control. All those things are reviewed while we are there, while we're there. What you see on the screen is the interview, closing interview. So we sit down with the operator or whoever's in charge while we're there. Sometimes they go along, and we prefer that they accompany us when we're doing the inspection, because then we can talk and address issues right then and there, and solutions can be done right then. I'm telling you, I don't know why. I'm sorry, excuse me. I'm sorry.
Oh, no worries, relax.
Mhm.
So you sit down with the restaurant every time?
At the close of the, yes, we sit down every time at the close of the, inspection, if they haven't accompanied us. But yes, because it's important when we're presenting the report of what we've seen, that they understand not just what we saw, but we, chapter and verse, if you will let me, we address it chapter and verse so that they know what was seen and so that they can put in place things that will help to make sure it is not a violation in the future. So yes, every inspection ends with an interview with the person in charge. Part of the reason for a menu review, I just wanted to go into that, is that there's a difference in when the menu says vegetable soup, whether they are making the soup from scratch or they're opening a can of soup. That will determine what the inspector is looking for, because if they are making the soup and maybe that's the special for the week, did they make it just today? Did they make it yesterday and had to cool it down and then bring it back up to temperature for service for the next day? So a review of the menu helps guide the inspection and the questions that the inspector will ask. Chicken salad, I love chicken salad. Anybody like chicken salad? So is the chicken salad you're being served something that was commercially made and they just opened a container and served it? Or is it made in-house? And if it's made in-house, did they cook the chicken fresh to make that chicken salad? Or did they make the chicken salad from Sunday's chicken special? Those things, yeah, and because the chicken that was cooked on Sunday had to go through a cooling process and a reheating and then a mixing. So all of those questions asked and helps again to guide the inspection process. So why we do it? We do it to safeguard the public and to ensure the integrity of the food that's served. We do it because it's mandated by law that inspections be done. And the main goal of any inspection is to reduce or prevent foodborne illness. And it's not just a matter of simply do what I've told you to. Our objective is to move from just knowledge so that they understand why and they understand what went into when we're citing a violation or citing a non-compliance. So they understand. So it's not just knowledge, you do what I say. It is, again, we have to be instructors, we have to be good communicators. We have to be able to help them to understand what the issues are, again, so that they are not repeated in the future. Next slide, please.
Carolyn, since you brought
Yes.
up chicken salad.
You like chicken salad?
I used to love chicken salad till my mid-20s, and I got some bad chicken salad, and I haven't had it since. So appreciate you keeping that safe for the rest of the chicken salad lovers.
I love chicken salad as well. So frequency of inspections, we have nearly 1,600 permitted entities. And I explain it that way because it doesn't mean that there are 1,600 establishments out there, but a Martin's, a Walmart, they have food store, food service. And so that entity that establishment would hold 2 permits, but each inspection is done separately on that, must be done on those permits. So there are 1,600 of them, plus 160 plus pools and spas. And so there has to be some method to our madness. So the frequency of inspections, all inspections are unannounced, contrary to some of the operators thinking that, that they know that we're gonna, people who call complaints that they know when you're coming. No, they don't know when we're coming. And we conduct those inspections by a predetermined cycle that we go through, rotation cycle that we go through the whole county. And the number of inspections as it's delineated there, the number of inspections that a particular establishment would get is based on the risk that's involved, the preparation, the population sometimes also will help to determine how often an establishment is inspected. Say, for instance, Family Dollar, you can run in there and get some bacon now, you can get some eggs at Family Dollar. So they are inspected, but that would only be once annually because it's low risk. Aldi's is prepackaged as well, but they have more things in there, more refrigerated, more things that could go wrong. So although it is a low risk, an Aldi's would be inspected maybe twice, not just once. Now look at a Hacienda or a Papa Vino's, that they've got menu items that they are making ahead of time, that they are cooling down, that they are bringing back up to temperature. I'm sorry, but some of those things that you like, they didn't cook it today. They cooked it, last week or week before last and are bringing it back. You like lasagna? May not have been done today, but those are all things that factor into the frequency of an inspection and how long. Now, schools are inspected fall, spring, and summer because they have summer feeding programs. So schools will get optimally 3 inspections in a calendar year. Next slide, please. So these are our numbers. Closest to the graph are 2023, the farther from the graph are 2022. And we've kind of grouped some of the services together, but you can see consistently that in 2023, we had significant increases in the number of inspections and the services. That is completely contributable to this excellent staff that we have, all trained. Thank you all for, and past board for getting some pay raises so we have less, turnover. We have an excellent trained staff. They come, as I've already said, they come already prepared. And so 3,441 inspections in 2023 is a lot of inspections for a staff of full-time inspectors, 5 inspectors. Karen and I both do some inspections, Karen more than I, but it's basically those 5 trained food safety officers. I wanted to take a look at, I'm not going to go through all the numbers, but take a look at the perfect inspections in 2023, 1,165 perfect inspections. Again, it's a snapshot in time. We're not saying this is a perfect establishment, but at the time that the inspector was there, they noted no non-compliance issues. Significantly higher than the 699 perfect inspection certificates that were distributed in 2022. Again, more frequent inspections means that we're catching things and people are being educated, people are being trained, communication is going on. So we get people who are doing what they are supposed to, they are compliant. So there's a direct correlation between the number of perfect inspections and the number of inspections that were performed. Next slide, please. So, going to talk a little bit about the type of inspections that we do. Routines are establishments that there's no again, that cycle. So we're coming around in rotation. And so we go in and do an inspection and we're making sure that they're compliant with code requirements. We are evaluating their risk factors. There's a set of risk factors that have been identified by industry that most frequently lead to foodborne illness. Things like unsafe sources, inadequate cooking, improper holding temperatures, contaminated equipment, poor personal hygiene. And these are actual photos from inspections. At the top, you can't wash your hands in a sink that's full of equipment. So that particular violation was written 59 times in 2023. Next, temperatures, and this is in cold holding. Cold holding should be 41 degrees or below. We've got a 50-degree temperature on some chicken, it looks like. Violations for temperatures were written 187 times in 2023. Okay, so right here you're saying, what is that? That's cooked chicken. It's chicken that has been breaded and deep fried and returned to the original carton that the raw chicken came in. And that is cross-contamination, because we got possible, raw blood juices or pathogens still in a container, and that chicken has been put in there. We didn't take a temperature of it. Is that room temperature? Because the cross-contamination was reason for immediate disposal. So they had to throw all of that out. I'm not going to tell you. You probably like to frequent those restaurants. Anyway, the next is a cart, a cart that was in the prep area. We've got single service containers, and it looks like some shells from some nuts. And yes, all of those little things are not sprinkles.
Oh, no.
They're not sprinkles. They are mouse droppings. Controlling pests is a non-compliance issue. And in 2023, we had 273 violations written for that. But when you take it in, when we're talking about over 3,000, almost 3,500 inspections, that's small, in comparison. Believe me, you all can go out and eat and feel safe to do that, okay? Complaint, next, I'm sorry, next. So complaints are investigated, usually consumer reported, because they're reporting non-compliance issues. We get a lot of complaints nowadays that come from social media also. People will call us and say, did you see, or we see it, okay? So videos and pictures. So right there on the, my left is a feather. Somebody sent us a picture of feather, and that, yes, is fried rice. They found a feather. I don't know where a feather would come from in fried rice, but this is an actual picture that was sent to us by a consumer. We had 234 complaints investigated in 2023. 20% of them were found to be valid. And that's a little humor. Eugene, what's with the hairnet and gloves? The health inspector wants everybody in the kitchen to wear them. It's a health regulation. And it is a health regulation that you have your hair properly restrained, not only the hair on your head, but the hair on your chin. And if you have hairy arms, that as well should be covered with long sleeves. Have you ever gotten a hair in your food? Okay, next slide, please. Possible foodborne illnesses. We only had 9 investigated in 2023. That wasn't food-related illnesses. It was possible foodborne illnesses because it's defined as involving 2 or more cases of a similar illness resulting from ingestion of a common food. So that means if you or your children, Ellen, say you got sick, we would investigate it, but we wouldn't investigate it as a foodborne illness because, Ellen, you could have made them sick. I'm sorry.
I was thinking about the chicken nuggets.
You were just thinking about other. Yeah. But this is a collaborative effort because nursing takes a part in that they, if there's more than 2 people involved, they will do the follow-up with the interview of the food, of what was eaten. if it is truly a foodborne illness, Hope gets involved and also state gets involved, because we have to interview not only the individuals that are sick, but the individuals that are well, so that we can determine what the issue was. Because sometimes people will say it was this, but it may not have been what they point out as the food that made them ill. Next slide, please. Fires. So I don't know if you can make out, but this is at the bottom, I'm going to the pictures first. At the bottom on the left is a picture that we actually received again from an employee. So why he wasn't putting the fire out and he was taking a picture, but we inspect the establishment after a fire. We evaluate, whether things should be disposed of. We examine the equipment for damage and cleanliness and schedule a date for a reinspection for a reopening. And we get calls at 5 o'clock in the morning, at 11 o'clock at night. And yes, we go out, don't we, Karen? Next slide, please. Temporary events. Everybody loves temporary events. We had 267 of them in 2023. We did 638 inspections. A temporary event is, as it says, a transitory gathering that takes place for a specific purpose. To be called temporary, it has to be less than 14 consecutive days. And we've got a couple of that you are familiar with that we have practically every year. Last year, the Fusion Fest, 2 days, all the staff were on hand for the Fusion Fest. And they present, some unique issues, because besides keeping food hot or keeping food cold, right here is a temporary hand washing setup. So all of those things taken into consideration. And then you got the bugs and the flies and the wind blowing, all of that. So it is a unique situation, and we do our best to make sure that you all and the citizens of St. Joseph County can attend those things and feel confident that they're going to not ingest food that's going to make them sick. Next slide, please. Food trucks. A couple of those might be familiar to you, or you've seen them around town. One of the things about food trucks is we've had food trucks, all 27 years that I've been here. However, with the city changing or amending their ordinance back in 2015, food trucks are now allowed if they have an annual permit, and if they are truly a truck, they can operate independent of any event or celebration. So that allows them to park downtown or park somewhere else in the county. If they are a food truck, a food truck must hold a permit as a mobile food truck, and they also have to have a permit as a commissary or base of operation, because they are required to go back to a brick and mortar so that they can restock, unload water, take on clean water. And so that means 2 permits, and that means 2 places to inspect for us. Next, home-based vendor. Now, I've included this because home-based vendors aren't regulated by us. They don't have to have a permit. We don't inspect their homes. But when the State Department changed in 2022, changed or amended their rules, they are required to hold a certificate sorry. It just left me. That's really.
Home-based vendor?
Yes, thank you. A food handler, sorry, that's it. Food handler certificate. It's a smaller version of what we have to, the manager goes through, but they are supposed to do that. And and they're supposed to register with us. That information is supposed to be on file with us, which is mind-boggling if we're not supposed to have any oversight. But as the slide says, we get 3 to 4 inquiries weekly about people who want to know what they can do and if they can do, and providing that information for us. So we do spend some time with home-based vendors, even though they are not regulated and not permitted by us. I'm going to let Karen come up and talk to you a little bit about the pool program.
Hello, Karen Teague, Assistant Director of Food Services. We handle the pool program, which we follow the state code for swimming, public and semi-public pools and spas. We do the inspections pretty much annually. They get re-inspected if there's numerous violations. They get closed for certain specific reasons in the code. And we have 3 of us, myself and 2 other food inspectors, hold this certified pool operator certification. The Pool and Hot Tub Alliance is very, very helpful. It's national, international. They offer all kinds of trainings. They offer maintenance type pool certification trainings, installer trainings for people who are going to work in the pool industry, building pools. But ours is for the certified pool operator. It's not required like a food establishment for a pool location to have someone, but we do ask for that information. And it is a very beneficial certification that we encourage, but we cannot require it at this time. Next. So when we do inspections, we inspect all of the public and semi-public pools and spas. That includes apartments, hotels, schools, homeowners association, condominium type places, parks. There might be like a camping park. There's might be 1 or 2. And we're checking the chemical levels to make sure they have all the warning signs, because they are not required to have a lifeguard if it's smaller than 2,000 square feet. So the signs have to have all those warnings, letting the user know all of the requirements. And the life-saving equipment has to be available for use within the enclosure. Each pool has to do weekly lab water testing and daily chemical testing of things that can be done outside of a lab type test. We do consultations, investigate the complaints, and make sure they're complying with the Virginia Graham-Baker Act, which I think came in effect in about 2007 or 2008 after some Indiana official, their daughter died in a pool by their hair getting sucked, and it pulled their entire body into the drain. So these drain covers with the green dots are an example of one that's approved. It's for anti-entrapment. So we look for those and make sure that they're replaced according to the manufacturer's life cycle. Because they were ANSI tested and approved for the amount of time. But even if a screw is loose, that's a violation. Next one. We look at the pool in advance of it being used, but before we see it, the state has reviewed the plans. They get a design release from the Indiana Department of Homeland Security. And then we would come out, do a consultation, make sure that everything was put together properly. Some pools that are transferring to a certain type of chemical, they have to do a 1 month. Water has to stay for a month before it slowly becomes a different type of chemical. So that was interesting. I'm sorry, I don't have the specifics on that, but so we do those water tests, make sure they have everything they need. If there's anything that would not allow them to open, we would come back again. They get an annual permit, same as foods. And at least an annual inspection. And it's, we have an ordinance for the pools, but our inspection reporting is based on the requirements in the Indiana state public and semi-public pool rule. Anything else? That's it for pools.
So as far as our goals for 2024, training and preparation for implementation of the 2024 Food Code, 410 IAC 7-26. Onboarding of the countywide integrated permit processing system, and update to the county ordinance to reflect the new revised food code. The food code that is been highly awaited are the code that we currently use. I call it the Bible. It's what we do all our inspections for the requirements that are there. Was effective in 2004. So we are working with a 20-year-old code. I heard something a couple of months ago that says Indiana is like the third oldest code in the nation. Third oldest. So I want to just take a couple of minutes, and I know I'm well over my 10, 15 minutes that we were supposed to have. But the implementation of this code is something is major. We have started monthly virtual training with the state on the changes. As somebody had mentioned, 35% of the new code is changed from the old code. We have in April on-site trainings, day-long trainings that we're going to have. We have not seen the code yet. We are told that we should get it in March, April, so that we can review it before we attend those trainings. This is major because terminology is going to change. Temperatures and certain things, basic things, food code, it's not going to change. You know, hot holding is 135, cold holding is 41. So that's not going to change, but the terms are going to change. How they refer to certain foods is going to change. And so not only is it a meaning of our being trained, but all of our establishments, those 1,600 establishments that we refer to, will need to have copies of it, and they will need to be trained on it. We've already been told the initiation or effective date is July 8th. And so we've already been told that it is onboarding is supposed to be gentle. So that we are educating more than anything. So we're that's a major thing. The countywide integrated permitting process is also, it's not just foods and environmental, it's other departments throughout the county. We started training last year, you know, for that, and that's expected. We've gotten several different dates, but it's supposed to come before the initiation of the new food code. Our ordinance is going to have some changes to it because, again, the reference to the code that's throughout the ordinance, the reference is changing. So it might be minor things that have to be changed, but the whole ordinance is going to have a review and a revision to it. Next slide. So I do want to thank you. I'm less nervous now, but thank you all so much. I wanted to say that with sincerity because I know that your tasks are not easy. Your serving as board members is not easy. And I personally want to just thank each of you for your service to the St. Joseph County Department of Health as board members. We need you and we appreciate you. A little more humor. I warned you about eating at your desk. The Board of Health impounded your keyboard. Did y'all eat at your desk? Any comments or questions?
Well, first, thank you very much, Carolyn, for your presentation and for your comments about the board. I appreciate that very much. And certainly, thank you for being an awesome captain of your team and for assembling such a great team. And thank you for all you do for our citizens and protecting their health. I eat out a lot, so. Yeah, and the restaurants are always full, so making a huge difference. So thank you.
It truly is my
For that.
pleasure. People keep asking, when are you? It's like, it's too much fun. I don't, where else could I go?
Well, it's just exhausting to hear what you're doing, let alone to do it all. So.
I'd like to know where you're eating out at.
1762 North and East Street.
Yeah.
It's not because it's not safe, but it's because after 27 years, they know you and they try to give you stuff, you know.
Any other questions or follow-up? I do have.
I-
Yeah, go ahead.
I had a couple. I was curious how much time you spend on a typical inspection of a restaurant. It sounds pretty thorough, so.
It varies. You go in and the manager or whatever is, or person in charge is going along with you. It may take 30 minutes, 45 minutes, may take an hour. We've had inspections that have taken longer than that, you know, when you're finding lots of non-compliance. And while we encourage the owner, the manager or person in charge to go with, it does make the inspection longer because we're addressing issues as they come up and they're asking questions and we're, you know, providing information and guidance. And so, but that's ideally how you want to do it, that they're there seeing it when you're seeing it and addressing it and speaking to their staff right then and there.
And if there's like a new restaurant opening, for example, does the owner have to have some sort of training? Do you have a new restaurant inspection where you're kind of giving the new owner, the new manager, kind of a summary of what needs to be done under Indiana law? How do you address new restaurants?
Great question. Thank you very much. We didn't include that. Karen and I, plans for a new restaurant are submitted first to the state and approved, but we are to get the plans as well so that we have reviewed that they have everything in place in terms of equipment and what ceilings and floors and whatever are made of. There's, you know, code requirements for that, you know, the placement of sinks. So all of those things are reviewed before, ideally before they start construction. It doesn't always happen like that. They are also supposed to have somebody in place as a certified food protection manager. So those things are already there. When we've approved the plans before they open, we go in and do a opening inspection. And that is just, again, making sure that what they said that they were going to do, what they said that they were going to put in it's compliant with that. If everything matches up, then they get an approval and they get a permit issued. In about 4 weeks, a month to 4 weeks, we go back unannounced. And this is an inspection to determine compliance with, you know, food handling and storage and that kind of thing. They are supposed to have somebody on hand as a certified food protection manager. So that is not necessarily what we do before opening, but it is something that we can do if there are issues after they open.
But you're involved even in the design process, correct?
They submit that to us and we make sure that it complies with what the requirements are from the code.
Wow.
And they get a written letter of approval, or they get a letter that says these things, you know, are not compliant. And so you need to tell us how you're going to fix those before you can move forward with the process.
Oh, wow. Okay. I didn't realize that you were involved that early in the process.
Yes.
Very cool. Thank you.
And even if it's not a new establishment, if they're changing or doing major modifications to, then they have to submit that as well
Okay.
for approval.
Any other questions or comments from the board? Dr. Pashutham?
No, I just wanted to say thank you. I'm really lucky to get to work
Agreed.
with such a great team.
Thank you, Karen. Thank you, Carolyn. Thank you both for your work and the presentation. Next item on the agenda under new business, item 2408. Department of Health Strategic Plan 2024-2028. I think Dr. Pashutham got the draft plan out to us last week, before the meeting, so thank you for that. And I trust everybody's probably reviewed it. Thank you for doing that. However, I have not had a chance to review it. So I would ask, I'm only one vote, but I would ask that maybe we table this issue and take it up next month if it's not a great hardship for the department.
I would be fine with that.
That's okay.
So I apologize. I just for reasons personal and otherwise, I couldn't get to it.
I'll move to table it.
Second.
We have a motion and a second. Do any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, and I apologize again. Next item on the agenda, grant request, item 2409. Discussion and vote, apply for an immunization coag grant.
Yes, we would like to apply for a grant opportunity through the State Department of Health. This would be our 7th year applying for this grant. The grant does not have a cap for the amount that we are able to ask for. And this does fund the majority of our immunization staff as well as our mobile immunization team in our department. And it will run from July 1st through June 30th.
All right. Any questions, Amy?
I'm curious, is the amount that we're asking for this year fairly consistent with the amount that we've been asking for in the past?
The current cycle that we are in now was a high ask. It was over $600,000 due
Uh-huh.
to needing new vaccine equipment. The State Department of Health did let us know that that probably wouldn't be an amount that could be funded in the future. So while keeping that in mind, we are still close to $500,000 with staff, with the 9 staff that we have currently tied to the grant, as well as just regular supplies and
Mhm.
equipment needed to run the program. So I am estimating that we're still going to be in the high 500,000s
Okay,
in our ask.
okay. So it says here, we're requesting approximately 616,000. Is that what we're asking for this year?
Our application hasn't been completed yet.
Okay.
Yeah,
Okay,
yeah, we're still
right.
working on our application.
got it. Okay, okay.
I did notice just a typo in the date because it says July 1st, 2024 to June 30th, 2024, just an FYI.
Yeah, we made that correction. Thank you.
Any other questions? Hearing none, I'll entertain a motion.
I move to accept the grant application as presented.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, I presume 24-10, discussion and vote for authorization to apply for a safety pin grant.
And this is a grant opportunity through the State Department of Health. We have applied for and received it twice in our previous 4 years, because it is a 2-year grant. This year, we are asking support to apply for it again. This year, it is a tiered award. We will be asking for the highest tiered amount, which is $500,000. And as I mentioned, it would cover 2 years, starting July 1st, 2024.
Okay, great. Any questions for Amy on this request?
Has it always been a tiered reward or is that
No.
new?
No, this is something new that they're
Okay.
doing the tiered amounts for. I believe there's 3 levels of funding available.
So you said that, I guess I know there are a couple of different safety pin grants out there. I think one that we have currently is for the community health workers.
That is correct. And that one,
Okay.
we did receive the performance award to extend for another 2 years.
Okay, and then this is a separate safety pin grant.
Correct. This is a grant that we had previously that funded our maternal infant health coordinator that we had on staff.
Okay,
This is another round of that funding.
okay. So, but that would cover, maternal infant health related things.
Right, reducing infant
Yes.
infant mortality,
Okay,
correct?
okay, but it wouldn't, okay. There are just several safety pin grants out there and I'm just trying to figure out.
Yeah, the
one
CHW
is-
one focuses on the Women's Care Center.
Okay.
This one is separate from that.
So, even though the focus is on reducing infant mortality, it seems like the grant itself is somewhat broad in terms of allowing, considering, programs that would, help improve infant health, maternal health generally, including maternal health, correct? And yeah, maternal mental health, things like that. So, I was just wondering, what you're hoping to use some of this money for, or I know, are you still kind of in the process of figuring out where this fits in the larger picture?
Yeah, we're in the process of figuring out how this potential grant would apply with all the other projects that we have and the other grants that we have available. We're hoping that perhaps we can use this grant as an educational piece that could complement some of the work that is being done by community health workers and potentially build on our growing MIH-CHW based programming for moms through
Okay.
their different levels of care or different stages of pregnancy and postpartum care.
Mhm.
And we're also thinking through what could educational programming look like so that it is accessible throughout the county and how we are able to refer individuals into those programs.
Mhm.
So our thought with this is perhaps we use this funding as an opportunity to develop our own educational material based on what we hear is a need and thinking through how we do that, whether or not we contract for services that are hard to find in our community and create those educational workshops that people from the county can come and attend. So we're kind of brainstorming what that could look like.
And, are you going to ask for and you're gonna ask for the maximum amount, that 250,000 is the
Mhm.
max?
Per year for
500.
2 years.
Yeah.
It'd be 250,000 per year and it's a 2-year cycle, so it'd
Yeah.
be $500,000.
Okay.
All right. Any further questions? If not, call for a motion.
Are you gonna do it?
Go ahead.
Move to accept, move to permit the department to apply? Is
Close
that what
enough.
we're asking for
Yeah.
specifically?
Permission to apply.
Permission to apply.
Yeah, second.
All right, we have a motion and a second. Any further discussion?
Nope.
All those in,
Sorry, permission, not to permission to apply, approval to apply, right? I don't know. You'll word it correctly, correct? Sorry. I'm getting caught up in the language.
a motion to approve the department applying for this safety pin grant.
That's good.
That sounds great.
Yes.
Thank you.
All right.
That's what I meant.
All right, any other discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is old business. We have none. Next item after that is public comment. Please sign up over at the table here to my right if you want to speak. And at our meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open session of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if it becomes personally directed, abusive, obscene, or inflammatory.
We have none. No one signed up, John.
We have no one signed up after all that.
I just want to hear you talk.
I know you guys staring at me. It's like, what's going on?
We're on a roll.
Did good.
All right, next item, time and place of the next regular meeting, March 20th, 2024, 4:30, here, same place, fourth floor council chambers. All good there. And the next item is adjournment. Entertain a motion to adjourn.
I'll move to adjourn.
We have a motion. Do we have a second?
Second.
All right. All those in favor, please say aye.
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 Opposed, same sign. Motion carries. We are adjourned.